This is Pod Populi.
Podcast for the people.
The Great Love Debate. It's the Great Love Debate.
The Great Love Debate. It's the Great Love Debate.
Hi again, everyone. It's Brian Howie. Welcome to The Great Love Debate, the world's #1 dating and relationship podcast. Since 2015, I am here in the very fine studios of Pod Populi, Podcast for the People. And I am at the one in Boca Raton. And Boca Raton is a Latino phrase, meaning, God, it's so fucking hot here. I can't even tell you. Florida in the summer it's not good. It's not. People say like, oh, Arizona is like 110. Give me 110 in Arizona over 95 in Florida. But anyway, I'm not here to complain about that. I'm here to complain about some other things. I'm going to bring her right in because I have a lot of ground to cover. She's been on this podcast before, not in about 5-6 months. She was very, very popular. You guys sent a lot of questions to follow up with her. I may or may not get into some of those questions, but I have a big question of my own. She is the host of the Dr. Sex Fairy podcast, the very popular Dr. Sex Fairy podcast. The Sex Fairy herself, Dr. Kanwal Bawa. How are you?
I am doing well. Thank you, Podfather. Thank you for having me back. Such an honor.
The reason that I'm so puzzled and I want to have you back is I want to talk about sexual confidence in men. Okay? I understand that men in their 40s, 50s, 60s may lose that. I am astounded by those males in their 20s and 30s who are not necessarily just lacking sort of emotional confidence. They're like popping Viagra 2 at a time. What's happened?
It's a shit show, my friend.
It is. Why? What happened there? Along like guys in their 20s can't get it up anymore? How did that happen? Or are they just paralyzed with because they've been emasculated so much? I don't even know what it is.
Well, here's the thing. 2 out of every 10 20-year-old cannot get it up. Isn't that amazing?
Can't get it up at all or can't get it up with a woman in the room?
Well, that's a good question.
Yeah. Do they get it up on their own?
Well, I think 2 out of 10 are having problems with it, period. Even in masturbation situations.
Is that on the rise, or are we just sort of talking about it more?
That is on the rise, but I do
no
think
pun.
That's funny. Good one. But I do think we are also becoming more upfront about these issues, and there are people like me who are talking about it and making it okay for a 20-year-old to admit that he has a problem, because that's how this whole thing with Dr. Sex Fairy began with me. Interestingly enough, you and I have discussed this before off air, that in the ER, I was seeing people coming in with a chief complaint of cannot get erection. And I initially thought I was being hazed by the ER staff. That happens.
So they'd go to the emergency room for that?
Yes, sir. So I looked at it and I said...
Don't call 911 for
yeah,
that.
Please. So I looked at this thing and I said, is this a fucking joke? I mean, this is an ER. I'm dealing with people who are dying of heart attacks and strokes.
Yeah, save it for the gunshot victims.
And gunshots, no kidding. And I look at that and I am 100% convinced this is a joke. Then I look around and nobody's laughing or paying attention to me as I look at this board. I'm dating myself because this is before things were on the computer. Mm-hmm. Used to have paper charts. So I'm looking at it, nobody's paying any attention to me. So I go in, I'm still not entirely convinced that this isn't a prank of some sort, but the guy's seriously traumatized. For one, he's embarrassed. He doesn't know where to even look. He's certainly not looking me in the eye.
Right.
And he's telling me he can't get it up. So I try to, as nicely and as kindly as I possibly can, in a busy, bustling ER with people dying around me, ask him what made it an emergency today. And he says, well, I can't have sex. That's an emergency.
Right. And is this the first time? Is it something that suddenly can crop up, or is it something that somebody always has a problem with and it tends to get worse?
There are people who always have it. In fact, premature ejaculation comes in mostly 2 flavors. One is men who've never been able to last, and one is men who were able to last and then now cannot for a host of reasons. So this
guy... They got a better-looking girlfriend.
Maybe. See? That's good. Pretty good.
Sorry, I'm going to make some jokes here. Sorry if you're one of these people offended by this. But the premature ejaculation thing, I get, and, when you're 16, 18, 20, everything is just overwhelming for you. Mm-hmm. Your hormones are going, your senses are going, you're not used to, you're not mature or whatever. But the lack of I don't know. I don't know how that would suddenly kick in to the point where they'd want to go to the emergency room.
Well, here's the thing. The system
Do they
is
think
broken.
they broke it? Do they think they broke that system?
No. I don't think he thought he broke it. I think our system is broken in many ways. Everybody likes to attack the U.S. medical system. I know we have issues, but we're still better than most places in the world. However, this young man was not getting attention from his PCP, who was blowing him off.
Right.
Again, pun unintended.
Pun unintended.
And so, he was fed up. And one night, probably after a failed encounter, he said, screw this, I'm going to the ER and I'll see what I can do. Now, unfortunately, I wasn't able to do a whole lot for him because I didn't have the tools I needed in that moment to help him. And that got me thinking, what was happening with this man that propelled him to come to an ER and discuss such an intimate topic with a woman he had no idea about and
that's ballsy
no follow-up
too.
with. Yeah.
Again, no pun. But that's to go to a stranger and to say this is an emergency. Yeah. Do they always say this has never happened to me before?
No, this guy was saying this is happening nonstop and I need help. Now, also, let's go back a few years. I'm at this point a board-certified ER doctor. This is one of the Cleveland Clinic hospitals, and I'm simply not set up for this. I'm not expecting it. I certainly don't have any tools to help him. Mm-hmm. But the thing is, it turned out that he wasn't an exception. This happened again. Now, I'm not saying I saw this every shift. I rarely saw this, but I saw this enough times that it got me thinking.
Is the first thing you do is check for injury?
Well, I asked him. Before I examined him, I asked him questions. And I wasn't finding anything, really. He wasn't doing drugs, at least none that he was admitting to.
Right.
Because that can be a problem sometimes. Mm-hmm. And this is back in the days when K2 spice was a big deal. People were doing those bath salts and everything. They were having all kinds of side effects. So you did ask those questions, but he said, I'm not doing anything. And this was not a situation where he was really, in a job interview or anything like that. I was helping him. Mm-hmm. So I would like to think he was being honest. But this happened many more times. And then, I'm talking about a career that spanned a long time. I kept seeing this in some shape or form. Or I was seeing men, on the other hand, who were getting Viagra and Cialis and Trimix and having erections that weren't going away. Now, initially, a man thinks, damn, this is a home run. This thing is lasting forever.
Yeah.
But then he realizes when it starts to get painful, and this is simply not going down, that he may have a problem.
Can the body become reliant on Viagra or Cialis and then it won't respond without it? Is it almost like the body's like, I'm not going to perform unless I get my meds? Well,
I think people who are on it, to some extent, yes. But I think people who are using it have vascular issues anyway, which in simple English means they have blockages. If you're responding to Viagra and Cialis, which are vasodilators, which means they're dilating the blood vessels to allow more blood to go around the blockages, they're not really fixing the problem. So what happens is that some of these people are using it and they're getting emotionally reliant on it. So I don't think it's really making a difference. Either they can or can't get an erection with it. So when they are getting an erection with it, usually they're not able to get one without it anyway. So I don't think that it's making them more reliant in that sense that they can't get one without it. They probably can't get one anyway.
Right.
But what's happening is emotionally now they're stuck to this. So I had a patient in my office just today, and I was talking to him about his hormone levels, which is a big issue. I mean, hormones that are askew can cause ED in and of themselves. So I was explaining to him that he had all these hormonal problems and how we were going to treat them. And he was just traumatized about the whole Cialis thing. And I said, look, we're going to start treating you, but you can't be on this and then say that the hormones are or aren't working because you are in a state of false, you have a false sense of security. So you've got to stop doing this, or we really don't know if the other stuff is working. But he's so mentally reliant on it that, he's just not into the concept of even stopping. We'll see how that goes. The story is yet to be, told, but we'll see.
Do you first have to look at it and is this physical or is this emotional?
Yes.
Are they, so it's most times it's anxiety?
Sometimes it's anxiety, but usually there is some level of physical problem. For instance, I will ask them, are you able to masturbate? Do you get hard when you masturbate? Maybe it's a relationship issue, but on his own, he's a champ. And usually that tells me if it's more psychological or if it's more physical.
That's the answer right there.
Usually.
And a lot of this audience is going to get mad at me because they know I'm sort of an pot crusader. Stop smoking so much pot, everybody. How much of it is that? How much of it we have a whole society of people to just smoke pot all the time, and it is affecting our bodies in ways, that didn't happen before?
In the ER, again, I'll go back to my ER training. We called pot a gateway drug because it seems benign and people get into it, and then they end up starting with other harder drugs, and then things kind of go downhill from there. Now, there's a whole section of society that is trying to convince me that having pot is great for sex.
There's people who convince you that Ambien is great for sex.
Yes.
I mean, that's all.
I don't even know what to say anymore because they're truly trying to convince me. They're never convincing me, but they're sure trying.
Right.
That I should discuss this issue with them because it's such a raging topic and people need to hear about it. And I always argue back that I have a problem with this because I don't agree with it.
Right.
It causes all these other problems. How is this helping sex when you're stoned anyway?
Right. I mean, we kind of get why alcohol. What is the reason why alcohol is bad for sex? It impairs blood flow? What is the medical reason?
Among other things, yes.
I mean, among other things, judgment I get, but what is it about if you're really drunk that things don't work properly? What is the physiological? What does alcohol do to the body that makes the man not? It makes it desensitizes. What is it?
Things simply don't work as well. You physically can't perform as well.
But what
on different levels? Because
of what? What happens to the body that you physically can't perform as well?
I'm not sure that any.
Can we get a doctor in here? Can someone answer?
No. I'm not trying to be evasive. No, I'm really not trying to be evasive. I don't know that the exact mechanism is truly understood to that extent. But your penis is simply not going to get the blood flow. Now, is it vasoconstricting? Maybe. But people who are having alcohol are simply not having the same level of erection.
Well, Viagra was discovered as a headache medicine. Is that right?
Blood pressure, I believe, I think.
Right. It was completely random. It was a side effect during the test.
They were happy men.
Right. And they're like, well, it might not work for the original intent, but hey, this is not a bad side effect, supposedly. But the men now are so anxious in a lot of ways, which is societal. And I get it. We have generations now of anxious people. That they're like, I better take the drugs just in case I have a problem. Like they're taking them preemptively, which is then, I like I said before, I think the body builds up tolerance. I mean, is that possible?
And recreationally.
Yeah, recreationally. Like, I'm just going to take Cialis and go roam around the club for 4 hours. Like, that's
fun. Yeah.
That doesn't sound fun. What are you guys doing out there?
I don't know what they're doing, but it's not a good idea because it has so many side effects. The one thing that I hear most often is that people are getting headaches and sinus congestion, which makes complete sense.
Right.
Because increased blood flow isn't just going to your penis, it's going everywhere. So they have increased blood flow everywhere.
Increased blood flow is bad?
Well, in some cases it can be because you can overload your system.
What do you tell people? What is the most common remedy for somebody who has a problem like this? Besides, you can't just say like, oh, double up on the Cialis. Like, how do you break it down and say, okay, we have a physical problem here. What is the most common physical problem of why either somebody can't perform or they have? Is there one thing?
It's usually blood flow.
It's blood flow.
It's overwhelmingly blood flow.
And what blood flow would be everywhere? Like, would they get lightheaded as well? I mean, is it a bunch of symptoms and that's the only one they notice because that's the only thing guys ever notice?
That's an excellent question. In fact, this is on my questionnaire with all of my patients because I ask them, have you ever seen a cardiologist? And the answer is usually no. Mm-hmm. And then they say, why the hell would I see a cardiologist? I'm here for ED. And I explain to them that if they have ED, sometimes that can be the first sign that their heart has a problem. Because not everybody's going to realize that they have cardiac blockages and that they may croak of a heart attack anytime.
Right. Especially if you're young.
Mm-hmm. But they will realize if their penis isn't working, they're not missing that one.
That's right. That's a recognizable symptom that this is not normal.
Yes. So I send everybody, at least I recommend that everybody see a cardiologist as well.
What is there a condition where somebody just has never got an erection and that has to be fixed? Does that happen at a young age?
It can happen at a young age, yes.
And is that a hormone issue or is it just pure anxiety? I mean, I guess it could be 100 different reasons.
It could be 100 different reasons. But yes, it can happen when a man simply cannot get an erection. In that case, if all else fails, they can get an implant. But an implant comes with a lot of issues itself because you're cutting. You can have nerve damage. You can have excessive bleeding. You can have infection. And the thing about an implant is pneuma is all the rage nowadays. It's the new implant. But I have seen people who have had pneuma done. Firstly, there are only a handful of doctors in the country who do it, so it's frightfully expensive. But it's controlled for that reason, so that they can control the pricing. It's nothing more than that. And so they come to me. They've spent a bunch of dollars on this, but they're usually coming to me because their partner is still dissatisfied, and so are they. And usually the issue is that they can actually feel the implant. So the top and the bottom of the implant.
Oh, the woman can feel the implant.
Yes, especially in a blowjob situation.
Oh.
So it's not helping the man get it on because she does not want to give him a blowjob because now this just feels odd.
Right.
So they come to me saying, what can I do now? And I say, well, I'm certainly not taking that thing out, but we can soften the edges. So then I help them with, different treatments I do so that we can cover up. Like
fat injections?
I can do fat injections, but more often than not, I'm doing something really simple like hyaluronic acid fillers. I also inject PRP to help build tissue in the area, build collagen around it.
Is that a permanent procedure? Or like, are you really going to screw it up if you take it out? Like if somebody they have anxiety and then suddenly one day they go to a hypnotist and they're fine. They take it out or is it really cut up too badly?
No, you can take it out, but I don't take it out. So they have to go somewhere else because I say, you go back to whoever put it in. I don't want to get into that. I just don't because I do non-surgical erectile dysfunction treatments and I'm very, very good at them. I like to not get involved in that shit show of implants.
Is it often that women come to you and say, my boyfriend, husband, spouse has a problem and he won't talk about it? What should I say?
Yes, but I have just as many men contacting me saying my female partner is not able to perform, or that she is having painful sex, or that she's not enjoying it, but she won't come to you. What can I do for her?
Well, that's called a segue. So it's going to be the ladies' turn after this. We're going to take a quick break. We're here with Dr. Sex Fairy. We're breaking down all of your, we'll call them issues, but I got to take a quick break. So we will be back right after this. And we are back. This is the return of Dr. Sex Fairy. We spent the first half of the show talking about the dudes, a little bit of their insecurities, a little bit of their physical issues, and way too much pot. Let's talk about the ladies. It seems like the ladies in their 20s and 30s, this is going to be a huge assumption. Somebody's going to get pissed. A lot of the non-desire for sex out of a woman in their 20s and 30s seems to be trauma related, meaning they had some experience prior to that makes them physically and emotionally shut down and lose interest in that. Is that just me as a dude saying that, or is that a real thing?
It's a real thing. I think past trauma is a big deal. If your parents had a shitty marriage and you grew up around dysfunction, you're likely to perpetuate it yourself. Also, women, even in today's day and age, feel guilty about telling a man that they're dissatisfied. And I always say this. I mean, one of my one of my favorite sayings, that I came up with is, if you keep faking it, you're never going to make it. Because they keep lying.
That's good. That's a good book. You should write a book called that. That's a good book title.
The thing is, in all honesty, they don't want to hurt the man's feelings, but they don't realize they're doing him a huge disservice.
Right. And you're doing the next girl a huge disservice.
And the next girl a huge disservice. So you're not helping anyone. You're not helping yourself get any pleasure. You're not helping the poor guy, because all men, I'd like to think, want to do better. They want their partner to be satisfied. So much of their manhood and their sense of, who they are in the bedroom is dependent upon the woman having that crazy orgasm like Meg Ryan and, When Harry Met Sally. They want that for her. So if the ladies would only be honest with them, they would have a lot better experience in the bedroom. But they don't tell them that. And women don't even realize, and women are going to get mad at me, but it is what it is. The truth is what it is. They've done studies on this. Now, I don't know the exact statistics offhand, but they've shown diagrams of a woman's external genitalia, and women can't even point out where they pee from and where the clitoris is.
Right.
It's alarming.
They couldn't pick it out of a lineup.
Yes, and they can't even pick out their own vagina out of a lineup. They don't look at it.
Right.
So when I see a woman and I examine her, one of the things I look at is clitoral size, because the size of a clitoris is important. It's not just male size that matters. because most of a woman's orgasm is going to come from external stimulation. Now, if you have less surface area, there's less surface area for the poor guy to stimulate.
Oh.
Or the vibrator to stimulate.
Right.
So it's not just, a male-female thing. But women don't even realize that. When I say your clitoris is very, very small, they say, really? Did it just get that way? Well, how would I know? I'm just seeing them for the first time. Now,
Right.
a clitoris can shrink with time, just like a penis can shrink with time.
Is that a blood flow thing?
Yes.
It is.
Yes.
So it's the same sort of
Same idea.
mechanism.
Because you have to have the good blood flow feeding it, or it's going to shrivel up and basically die. Not what I'm saying literally atrophy, but
Right.
or literally have gangrene, but it is going to atrophy over time.
So it needs more use?
You do have to use it or you lose it.
There you
It is
go.
true. But you also have to have the blood flow, see? That's where acoustic wave therapy and some of my treatments come in, because we are literally breaking down those blockages painlessly, externally, without doing anything invasive. So you can come in and there's no downtime. Mm-hmm. So people literally come into my office and I tell them, listen, you can have sex on your way in and on your way out. Don't get arrested. There's no downtime.
What are you doing?
They literally come in, we have the men undress, and we do it for the women too.
Right.
We have them undress, we get them on the table, about 15 minutes of treatment. We are using sound waves, shockwave therapy, and it sounds scary and painful when I say shockwave therapy, but
Right.
it's really not. And you basically break down those blockages that are causing the dysfunction in the first place most of the time.
So just like some men are just, I guess the term is naturally gifted, women can be too. Women can just be designed in a way that it's just easier to please.
Oh, absolutely. In fact, the distance between a woman's clitoris and her vaginal opening has a direct relationship with how orgasmic she is. Because then, if it's a shorter distance, the penis will stimulate the clitoris without even trying. And so the more it gets stroked, the wilder she gets with pleasure.
So, and that's a procedure? I've never heard this in my life
the
talked
thing
about.
is-
Probably
the
with
thing
the
is,
wrong women.
a
my whole
woman's-
life. But
Well-
that's, how many people know that? Like, I wouldn't know that.
Well, that's why I'm the sex fairy.
I get it, but most people just like, that is the way. So that can be, is that a cosmetic procedure? Can you move everything closer together? I don't know.
I don't do that sort of thing.
But
You're either,
does that exist?
I don't think so, not really. But you
Well, I'm
can
onto
make,
something.
but you can make the clitoris bigger. Not where it's a tennis ball between your legs, but where it's big enough, a little meatier than it is, and you suddenly have something to work with.
And that seems like a shot.
It is a shot. I call it the Bawa shot.
Okay, so what is in this shot?
The Bawa shot.
It's a special
as I love
brew.
to call it. Yeah,
I mean,
it is a special brew.
Okay, and is there some sort of, is it vitamins? Is it blood? What is it?
Well,
If you don't mind saying.
I take blood out of the arm, spin it down into platelet-rich plasma. I make it stronger, turn it into fibrin matrix. And that basically means that it is more gel-like, stays in the area longer. A lot of people have heard about PRP.
Right.
But PRP is a sloshy fluid. It's very, very good, very, very effective. But it stays in the area for about a day or so. But fibrin will stay there maybe a week because it's gel-like. It's not going to just slosh out of the area. So it's more concentrated growth factor, and it's going to stimulate more stem cells. So it does a lot. For instance, it makes a woman more sensitive. It helps increase the size of the clitoris a little bit because it's promoting collagen. And that means that she's also going to make a few more blood vessels, believe it or not, from just this. So blood flow is a good thing. When you have flow, you grow. I say the same thing to the men about their Bawa shots to their penis.
Get healthier. Lay off the McDonald's, everybody. Is that how much of it in a woman then? She's not having sex, or she's anxious during sex because most women cannot have sex from penile penetration.
Only 18%
Only 18% can.
can.
And because most guys don't know that, the women are going to be like, he is just going to be ramming me like he says in the porn movies, and this is going to be and so she's naturally averse to having sex because he doesn't know.
He doesn't understand.
Right.
And in his defense, she doesn't understand much either.
She does, so she thinks she's weird and thinks she's
She
unusual.
thinks
because
she's a freak because in the porn movies, and again, I'm not here to preach for or against porn movies. It is what it is because of all the drama that the porn star women are doing.
Right.
And they're looking so, completely and totally orgasmic when he is pounding her.
Right.
That they think that same level of...
Or their
Boom,
friends
boom, boom
brag
is-
about, oh
yeah.
my God, we had the great sex. And then so she's like, oh, I'm not having that. And then she dreads the act
dreads
and
the
she's
act.
nervous about it, and then both sides are anxious, and he's like, she's faking it or she's not reacting at all, and all of these things
it
are
hurts
perfectly
the
normal.
relationship in every way possible. So by being dishonest or trying to protect their partner, they are just perpetuating this vicious cycle of pain and dysfunction, really.
So is that something that she should say, like, right away? Like, listen, I can enjoy lots of things and I can enjoy sex or whatever. It's probably not going to be what does it for me, but there's 100 other things that do. Like, she has to research her own body, right?
Yes. In fact, I have a TikTok account, Dr. Sex Fairy, and it's got 39 million views in just 4 months. And I believe that I have this kind of success on TikTok because I'm coming up with topics that people don't know about and that their doctors are not talking about. So I'm asking simple questions and giving simple tips that make people go, really? I didn't know that. For instance, today I posted a video about 5 tips for men to turn on their woman. Number 1 was talk to her about what turns her on. Because she may not talk to you, but maybe you can broach the topic. Somebody has to start. And, might as well be the man. Why not? I mean, I do think women need to take initiative for their own pleasure, but 93% of my followers are male. So I'm trying to take one for the female team and encourage the men to start that conversation.
Yeah, I mean, it's got to be hard. Again, no pun. 2 people, you go on a date or you go on a couple dates and you're ready to have sex, and you don't want to take away the spontaneity or any of the intimacy by saying, like, here's what I like, and here's what I don't. But you kind of have to have these conversations at some point. Yeah. So there's ways to have them either during and all that makes it more fun and playful versus here's a list of what I can do.
Yeah, I mean, maybe
I don't know.
you move his hand to where you want it to be.
Right. There can be encouraging.
Nicely. Yes.
Usually nobody wants to say anything. It's like, oh, no, ew. And then he sees the look on her face and it all goes bad. A lot of relationships go bad because an intimate moment can backfire because either somebody didn't say things in a way that they should have that was encouraging, or they just didn't really know and they were just sort of winging it, or it's a drunk experience and then neither one really got anywhere. And then the second time they do it kind of sober and like, ooh, that's not the way I remember it when it was drunk, and so on and so on. So all of these things, you're trying to build confidence in your partner, but you're also not trying to build false confidence in your partner because that's going to backfire too.
And backfire badly.
Yeah.
For instance, some positions are painful to women. And just because it looks good...
To all women?
To some women.
Well, I mean, some things are painful.
Everybody's anatomy is a little different. So maybe doggy style hurts one woman, but another woman loves it.
But it might be different with a different guy.
Yes, because maybe he's moving a different way and his size matters too.
Or he's curved or thick. Or
How he's
So she's got to try. I mean, so she shouldn't. I tried this once. I didn't like it. Yeah. That's not enough, right?
No, that's not enough. You have to have an open mind.
It is. Well, you're of Indian descent. Kama Sutra, isn't that what we were supposed to try stuff out? Isn't that the basis of that?
Yes. And what's interesting? The Kama Sutra is very much pro-female pleasure.
It is.
Much more so than many of, the books you may have come across growing up, and much of social expectation about what India or Eastern cultures might be. It was very pro-women. In fact, even homosexuality was mentioned, and not negatively.
Yeah, I mean, I grew up thinking that any intimacy or sexual relations that I had with a woman were a girl, I guess at the time, was a favor. It was a favor to the guy. I remember the exact moment my friend Jen, and I'm still friends with her, and she knows, who told me, and I was probably deep into my 20s at this point, where she's like, if you do it like this, I might like it too. And I'm like, what? This is part of my Catholic school background. It was like it too. I thought it was just something you guys would do for us, because you're supposed to. It never ended. And that was that. I mean, looking back, that seems ridiculous, but I'm sure a lot of guys thought this way, because we do like it quicker earlier. Men are like that. The women's sexual peak is what, in her 30s?
At least, yeah.
At least. So thank God our sexual peaks as men and women don't coincide, or we'd never get anything done. I mean, that was kind of a good thing.
It takes us women a while to come into our own, I think. And I think younger women lack the confidence sometimes that older women have. And I think 40-plus women just don't give a shit.
Right.
After a point. They say, get this done right, or I'm not interested. But even they are not necessarily aware of all the details about their own anatomy. And I think it would behoove a woman to perhaps go check out my TikTok or my podcast. And I'm not saying that for followers. I'm just saying because I give concrete information, and perhaps look up something. If nothing else, go Google a woman's external genitalia. See the diagrams. Learn where your parts are. It's sad when a woman doesn't know the difference between her urethra, where she pees out of, and the vaginal opening where the penis goes. A lot of women think they pee out of that same hole. It's scary, but
we're here to help you here at the Great Love Debate.
Yes, we are.
We do have a fair amount of listeners here who are over 60 on both sides of it. Florida, where we are right now, is filled with 85-year-olds having sex like on a level that they never had. Is there a second act sexually when the woman either gets through menopause or the man kind of can work through his physical issues with the help or not with help or whatever? There is another act that is out there for people, right? It's not over.
Oh, no, sir, it's not. In fact, I will tell you a short story about Jim and Cindy.
Okay.
These are my patients, and these are their real names. And I can say these because their story has gone viral around the world. So Cindy came to me. Cindy had been widowed for several years, and her husband had some issues prior for many years. So sex had not been happening. So her vagina was kind of, in some disrepair.
Closed for business.
Closed for business. She meets Jim. Jim and she have a lot of attraction, but they don't necessarily have the function to go with it. So she comes, and I do vaginal rejuvenation on her, CO2 laser, acoustic wave therapy. I did my, Bawa shot, as I call it, and we did a whole lot of different things. Not like 1,000 things, but a few different treatments, because one treatment doesn't fix it all. People have that mentality, why should I do more than one thing? Well, do you eat more than one thing at a meal? I mean, it takes more than just one thing. So we did a few things. She was just exceptionally happy with her results. She brought him in. He didn't come in initially. And now he came in, and I did acoustic wave therapy. I did, the same Bawa shot on him, and now he is buzzing. Now, those two, I swear to God, from everything they have told me, I'm not in their bedroom, but from everything they have told me, they're having sex twice a day, and sometimes they pull a nooner.
So they both went. She went first.
To me. Yes.
And then she could vouch for it, obviously,
yes.
but that had to have been a conversation. Like, we like each other. Let's figure out how to open this Pandora's box.
She was 70. He was 69.
Wow. Good for them.
Yeah. And in fact, he came to my office and he was telling me, he said, he was wearing a T-shirt that said Beyond Legendary. And I was like, yeah, hell yeah, you are. But then he says to me, my friends ask me, when was the last time you had sex? And they're thinking he's going to say how many years ago. And he says, what time is it right now? Now, this is legit, my patient.
Right.
And when their story got picked up, they came on my podcast. And they also did a couple YouTubes with me on my YouTube channel, Dr. Sex Fairy. And this got picked up by the press. So Insider.com contacted us, and we ended up doing a story through them. And then multiple outlets around the world picked up their story, even in Southeast Asia, everywhere. Because people wanted to know how the hell a 69 and 70-year-old were having this kind of sex. And the other thing Jim mentioned to me was, he said, it's very interesting. When I tell people I have a raging sex life, they assume I'm with a younger woman.
Right.
But I'm with a woman who's technically a year older than me, my cougar.
Yeah, and a lot of men think that that's the key. They need to go really young to get things to work again and turn them. No, I think they just have to have a willing partner.
Yes.
You're 65, the 23-year-old, she doesn't find you that attractive no matter what,
Unless you're a sugar daddy.
Oh, I'm a sugar daddy's different, though. That's not about you physically.
It's only the money that's
only the money. Like, is that what you want? That she wants your money? Then you're essentially paying for it. So that's
the beauty
different
of
show.
this, that, they were able to connect emotionally and sexually.
Right. And they're at a point in life, like, let's take this on together. And I think that can happen for a couple people in their 20s, too. Like, we like each other. Let's fix this part of our relationship. Let's seek some help. Let's ask some questions. Let's communicate with each other. Don't wait to sneak off to the ER in the middle of the night. And
the best part of Jim and Cindy's relationship and the fact that they came to me is not that I got paid by them. Yes, I got paid, but they invited me to their wedding.
Oh, really? Oh, man.
How about that?
So are you at the table like, how do you know Jim and Cindy?
Well, at this point, the whole world knew about Jim and Cindy, thanks to you.
Wow. Good for them. Oh, man. Good. That's a good story. I like that.
Great story.
All right, we need to round up Jim and Cindy. All right, tell everybody how they can find your podcast and get in touch with you for all these
They can
Bawa
find
shots.
my podcast, Dr. Sex Fairy, everywhere podcasts are available. And I am also available on TikTok. My TikTok is a lot of fun. It's Dr. Sex Fairy. On Facebook, I'm Dr. Sex Fairy. And on Instagram, I'm the real Dr. Sex Fairy.
Oh, is there a fake Dr. Sex Fairy?
Well, I had a Dr. Sex Fairy account, but it somehow got deleted before I could even make one post. So it's not like I had the chance to piss Instagram off.
All right, so it's not out there with some other Dr. Sex Fairy.
No. It just disappeared. I could never log into it again. And of course, there's my website, drsexfairy.com.
One piece of advice for both the men and the women out there is to what? Ask questions?
Ask questions and be honest with your partner. And also, don't be in denial. When you need help, go get it. And one final word would be know the importance of preservation. If I could just have $1 for the number of people that say, I don't think I'm that bad yet.
Right.
Sad.
Then you wait too long. Yeah, and the other thing I think everybody should know, no matter almost what topic we're talking about on the Great Love Debate, you're not the only one feeling this way. You're not the only one experiencing it. You're not the only one going through it.
Yes.
So you're not just some weirdo, oh my God, I'm 24 and it doesn't work. There are millions of people just like you.
Just like you.
Right. And if you think you're home free, hey, there's a lot of forks in the road in life. Who'll say? Thank you. As far as us, as always, like, share, follow. Please review this podcast and Dr. Sex Fairy. Your reviews mean a lot in the podcasting ecosystem. Go to our... I'm just going to give you the next show, September 21st at City Winery in Boston. That show might be sold out. If it's not, you can go to citywinery.com/Boston because they have a bunch of locations. Go to the Boston one or go to greatlovedebate.com for tickets to that. It's going to be really fun. We're filming a special thing for that. It's going to be awesome. Shoot us an email, greatlovedebate@gmail.com if you have a question, comment, thought for us, or something you want us to pass along to Dr. Sex Fairy. Because, as always, at the Great Love Debate, we never stop making love. See you next time.